So you're being who you are, going about your day, and suddenly you notice your vision is changing. Things are fuzzy, there are floaters everywhere, maybe even a little bit of pain, there's distortion. You go see a couple eye doctors, you finally meet a retina specialist like me, and we tell you that you have a white dot syndrome. What is that? Let's talk about it. Hi, my name is Zach Oki. I'm a retina specialist in Irvine, California. A white dot syndrome refers to a whole set of things in which, shall we say, white dots can develop in the back of the eye. Saying the words white dot syndrome is almost like saying the word sports. When you think about how many sports are out there, football, basketball, electronic sports like video games, whatever, there's almost nothing in common aside from competition, really. Similarly, with a white dot syndrome, we'll find certain patterns or certain appearances that help us understand what happened, but it's a giant class of conditions that affect the retina. Usually white dot syndromes occur due to an inflammatory problem. That's the most common etiology. That is, there's some part of the body that's inflamed, and it manifests usually only in the eye. The most common white dot syndrome that I have encountered is something called multiple evanescent white dot syndrome, otherwise known as MUDS. The classic description of this condition is that someone, usually a young female, but it can happen to both genders, develops a virus. That is, something in the body gets really inflamed. For example, like a viral infection, like a cold. People get over the cold, but then suddenly just one eye starts to develop this kind of hazy, shady vision. There are a little bit of floaters here and there might be little tiny missing areas of the vision as well. Then we examine the eye, and what we see are, again, just in one eye, we see like little creamy looking deposits underneath the retina. When we shine another wavelength of light at the eye, like a black and white photograph can be taken that way, and we see these fluorescent defects all throughout the retina, and they're usually centered on the optic nerve. This usually is a self-limiting condition. Usually corticosteroids or other medical treatments are not necessary, and then it goes away and the vision comes back. And this is just one example, but there are some white dot syndromes which can be blinding and life-changing and horrible and require a lifelong treatment strategy to prevent permanent blindness. Probably the most prominent white dot syndrome that fits that description is something called birdshot choroiditis. In this condition, people are born with a genetic predisposition due to a type of white blood cell called HLA-A29. When people have this, then the blood vessels that sit underneath the retina, the choroid, they become spontaneously inflamed, maybe due to a viral infection or a vaccine.